See, we all know that diabetes is a multifactorial disease, too many causes, but whatever it may be. This problem is just a metabolic disorder in the sense the body fails to handle the carbohydrate or what you call the sugar, blood sugar, in a proper manner. We need energy, and the immediate source of energy for our body is carbohydrate, that is glucose. So, after digestion, the glucose enters into the blood, and the cells or the organs they take the glucose with the help of insulin. So, I told it is a metabolic disorder. So, what is metabolism? So, you have food like carbohydrate, fat, protein, etc. And these three gives energy to our body. The cell, after getting the glucose inside, converts it into energy. For the entry of the glucose, you need insulin. This is a concept. If the metabolism or the glucose conversion into energy goes on properly, then whatever you take in is utilized properly, the circulating blood sugar will get reduced. If you want to reduce the blood sugar, what you do? If I take food, my sugar rises. So I will cut my food or I will restrict my food. You call it dieting. This is one thing. Now, whatever less food you take, even that may not be used by the body, so that remains in the blood. Now, what you do, the sugar which is there in the blood should be taken up by the body to convert them into energy. So, naturally, you do exercise. So, exercise increases the demand for glucose, and this glucose is taken up by the muscle cells, and naturally, the blood sugar gets reduced. The second thing is you do an activity and you make the glucose enter into the cell, converted into energy. The concept here is if the glucose which is circulating in the blood is converted into energy by some means, you can control the blood sugar level. This point is taken up by this particular method, the red light therapy. So, what they have done in this study, they took 30 people who are normal people who are not diabetic. First 15 people they were exposed to this red light, and the second 15 they were not exposed to the red light. Now, what you do, you take these 30 people and give 75 grams of glucose in an empty stomach. All the 30 members were checked how their blood glucose increases. They started checking these people every 15 minutes and they noted these values. For the people who were exposed to the red light therapy, there was a reduction in the initial spike to the extent of 7.5%. That's one. Second, the overall control of rise in glucose was less by 28%. Red light therapy people, it was less actually. So they proved that people who are exposed to this red light therapy 45 minutes before this glucose has caused a reduction of 7.5% in the initial spike and around 27 to 28% overall control. Remember, this is done on non-diabetic people. That means people who are not diabetic. The wavelength of the red light which was given to these people, these 15 people, was 670 nanometers. This is a particular specific wavelength, and they proved that it has got effect on the rise and fall of the blood sugar. Now the question is, why red? Why not other colors? See, we are all exposed to blue color in the light to which we are exposed. Even if you take the LED light, the quantity of blue color is high and the red color is very less. Blue color has the character of dysregulating the blood sugar, but red color has the characteristic of handling the glucose properly and reducing it. It has been proved. The next question is, to which area this red light was exposed to them? These people were exposed on the back side for 15 minutes. Now the other question is, they are exposed only on their back. Will it have effect on the whole body? Yes, it is. This has been proved in various studies. Very important question is how this red light works. Simple. I told glucose is converted into energy by the cells. Inside the cell, you have a cell organelle called mitochondria. That particular mitochondria is called a powerhouse because this is the one part inside the cell is responsible for conversion of this glucose into energy. Now, this red light has the capacity to stimulate this mitochondria, which are the powerhouse of a cell, and this mitochondria converts the glucose into energy. For this conversion, the glucose from the blood is taken by the mitochondria. So naturally, the glucose level, the blood sugar level starts decreasing actually. There is a mechanism, proved mechanism. But only thing is, it is done on non-diabetic people. They are yet to do it on diabetic people and to prove whether it is useful or not. But remember one thing, this red light therapy is not new to us. This has been there and people are doing it for many conditions like wound healing. Even in depression, they are doing it. Some type of cancers. So this red light therapy has been there in as a treatment for long. Now the next question is there any side effect? Definitely not. And this is a very easy procedure. No instrument, no equipment, non-invasive. Anybody can do it. The next question people ask is, so if I do this, can I stop the drugs? 100% not. Remember one thing, the body needs insulin. That's all. Nothing can replace insulin. But what we do is, when we have this lifestyle modification, this type of alternate treatment and all, the dosage of medicine will be reduced. The quantity of insulin you are going to take may get reduced. So this is only a supportive therapy. Tablets, insulin, lifestyle, weight reduction, all these things, they contribute a little percentage in controlling your sugar. This is one such technique. But remember, it is yet to be proved whether it will interact with insulin or tablets, etc. We are yet to get more information. So we'll wait till we get more information and I will update on this topic. People will not stop here. Definitely we'll get more information on this and I will share this with you. Till then, bye. Thank you.